we reach our rib cage and thoracic spine, there's a lot of grief that can be associated with our chest. We build up a lot of emotions in our chest. Our rib cage houses our heart, and the muscles around our rib cage can very much tense up and cause our actual ribs to press together, pull apart. I want you to start palpating your chest. So really find, you have your center portion of your rib cage. You have this small bone at the bottom called the xiphoid process. Don't mess with it. And you have the top portion that interacts with your collarbones. So just to the side, you can have tight and tender regions. We call these our grief spots. Our rib cage houses some vital organs. A lot of people can guard in these regions, and whether you feel pain or not, when you start palpating and pushing on certain regions and then you find some tender spots, like right in here at this moment, I have some tender spots right at this upper rib, that has interplayed to the opposite side of the body because of the slings, and typically we have cross body patterns. So I want you to start opening up all the way from the bottom to the top of our rib cage. You're really gonna find some tender spots. This is just alongside. Then we can get into each portion of the rib cage. So we go to the rib cage and we can really feel our intercostal musculature, which are the muscles between our ribs. And do the best that you can to use your hands alongside the body and really start to press, strum, and start to open some of the tissue that might be tender there. As you're pressing on your chest, you might find some clicks and cracks occurring at your collarbone, at your shoulder joint, in the lower part of your rib cage, maybe into your lumbar spine, low back, even some hip. As long as you're not diagnosed with any sort of separation or break within your spine or rib cage, that's okay. These are your muscles unlocking, and then your bones are needing a place to go. They're trying to seek optimal alignment. So as you work on this process, you could be unlocking some things within your neck as well. So it's so important to just know that the further and deeper you go within this process, the more and more opening there'll be within your body. As you open up your chest specifically, and opening up some of the previous wounds you might have, emotionally, our subconscious will process these emotions that have occurred in our life. And you have to be able to process the emotion and then let it go. So this is a very sensitive region. All of our rib cage really opens up because it has a lot of interplay with all parts and all aspects of our spine.